I'm Rashmi Halker Singh. I'm the Deputy Editor of Headache. I'm joined today by Noor Amalina Mud-Isa, who is a PhD candidate and one of the authors of a recent publication entitled Neuropathic Changes to Corneal Nerve Endings, a potential objective biomarker for migraine frequency and response to treatment. Welcome. I'm so happy you're able to join us today.
Thank you for having me today. Yeah.
So your paper is very interesting. This is, not something that we commonly come across. And I was curious if you could share with us, what's the relationship between migraine and corneal nerve morphology? Why did you choose to study this topic?
All right. So cornea is, one of the most densely innervated structure in human body. And then the corneal nerves is mainly come from the extension of the ophthalmic division from the trigeminal ganglion, which is the key structure involved in migraine pain. So that is one thing. And then people with migraine were found to have high level of a protein called CGRP in the serum and more in tear film. So this tear film CGRP could mainly come from the corneal sensory fibers of the corneal nerve. So there could be quite a lot potentially going on between the corneal nerves and migraine.
So that's very interesting. Well, tell me about your study. What did you all do?
Yeah, so my study focused on the migraine and the ocular surface. So you want to see how the front surface of the eye would be involved or affected in those with migraine. Yeah.
And what did you all find?
So far, currently, we found that the corneal nerves in people with migraine is implicated, especially in those with chronic migraine. And we also found that there is no difference in corneal nerves between those with episodic migraine and those with previously had chronic migraine. So in this sense, I think that there is a good potential for the corneal nerves to be a support measure for migraine condition, whether we want to assess whether the condition is progress or regress, or maybe evaluating treatment response in migraine.
Evaluating the treatment response by checking the corneas?
Yeah, the corneal nerves especially. Yeah.
Okay. So what else do you think this means for people who live with migraines? Is there anything else that we can do from this perspective, or where else do you see this research going?
Well, I think looking at the potential of corneal nerves in evaluating migraine condition, this could be a great aid for clinicians and researchers, especially in migraine management and or in clinical trials, in fact. And basically for migraine patient, this could help from both diagnostic and also management front. Yeah.
Yeah, I think this is very interesting. It's one way of looking at migraine or thinking about migraine that I don't think we often consider. And I think it also adds some validity to the disease, which we often think about as being an invisible condition. So it adds another way of considering migraine beyond MRI scans and other things, looking at the, corneal nerve. So it's very interesting. Thank you so much for taking the time to speak with me today. And we look forward to more research from you.
Yeah. So basically, for the next direction, we are looking at we are interested in looking at the association between the ocular surface and migraine treatment.
Okay.
Yeah. Yeah, and then we want to see whether the corneal nerves could be, apart from support measure, we want to know whether the corneal nerves could be affected by the types of treatment given.
Okay.
And yeah, and then we want to have a look at because another thing is we know that dry eyes is also one of the comorbidity of migraine.
Yeah.
So we're also interested in understanding whether treating dry eyes in patients with migraines will make a difference. Yeah, we are going to that direction.
All of that sounds very interesting. These are all things I come across in my clinical practice, and I can't wait to see what you find.
Yeah, sure. Thank you.
All right. Talk to you soon.
Yeah.